welcome to Therabytes, where we bring you bite-sized episodes, each one a piece of the puzzle that helps to explain the therapy world, the research behind it all, and how it relates to families. My name is Dr. Dana Poole, physiotherapist and clinical lead at the Healthy Strides Foundation. It is my privilege to be hosting this podcast, one that is directed for families of children with neurodisabilities. We hope to be able to answer some of your questions through this format. To help us navigate our way through these big questions, we have the lovely, the one and only Kate co-hosting this podcast. Welcome, Kate.
Thanks, Dana. It's so great to be here again to continue our conversations.
Love it.
I'm really looking forward to hear what your Did You Know is for the day. I love this part.
Well, yes, this part is always a little bit random, which I think is the whole idea of it, possibly. But look, there's certain research that really catches my eye. There's some stuff that I just go, why? And who does that? And who funded it? But this one I can kind of relate because I think it might have some implications for us in the future. So we found that, did you know that music that you listen to can make a difference in your brain connectivity?
Ooh.
Well, you know, that's why I think people always use classical music as the example.
Mm-hmm.
You know,
yes.
they put it on pregnant ladies, they listen to classical music. I'm not sure what the evidence is for that, but it sounds intellectual.
It does,
right?
Absolutely.
So these researchers thought they'd try it in stroke survivors. And so they played music at 2 hours a day for 2 weeks of Mozart and Beethoven. Mm-hmm. For those in the know, that's the classical era when it comes to classical music, usually occurring up to 1750. Well, starting from 1750, so I won't get corrected on that. And so they found in this particular one that people who had experienced a stroke, particularly aphasia, so it's where speaking, writing, reading and understanding is impaired, they actually found that it improved their scores when it came to their language as well as their EEG.
Oh, wow.
Right. So you're like,
that's useful knowledge.
Exactly.
Yeah.
So look, it was just a small study. It's a pilot. They're going to investigate it a little bit more because they compared it to people who didn't have that music being played.
Yeah.
And look, there's a greater understanding now that aphasia, we used to always think it was like one part of the brain that was affected, but now they know it's about the network throughout the brain that's affected. And when you think about music, it connects everything.
Yes.
So there's something about it.
Ooh, but not rap music.
No, not. All I can hear is my mum's going, just turn that down. What are you listening to? It would be really great to know, like, what that impacts that So I always feel like classical is like the safe bet. I reckon it's like non-offensive. You can just listen to Moonlight Sonata for days on end. But look, it's something that I think there is value in knowing the environments that we create for people when they're having rehab. And I don't know, when you think about kids, they often have like irritability as well. And again, they play classical music at train stations to stop like violence.
Oh my gosh.
They found that it reduces antisocial behavior. So they do play it. So there's just something about it. Maybe rap music enhances it. It's the opposite. So look, somewhat useful. Keep an eye on it. And I think just be aware of the environment that you set up around yourself.
Amazing. Thank you. That was a good one.
Thanks. Not too random.
No.
Well, what do you have for me today?
Okay, so this one is another tricky one for you, Dana.
Okay, good. All right, well, here for the tricky.
So I know this is something that you've actually helped us with in the past, and it is a common conversation that we've had with other families like ours, and that I know other families are having with their medical and therapy teams as well. Yeah. And it's to do with troubleshooting when something's wrong with a nonverbal child. Yeah, so it's obviously quite distressing for everyone involved when you've got a child that is clearly telling you something is wrong but can't tell you what it is, and you can't. It's not something really obvious to you. So I think it would be really great to know your thoughts on how we could go about that.
Yeah, that is a tricky one, and I think it's one that we need to take really seriously because when a child is nonverbal, their form of communication for us is going to be through crying. And the more we don't understand them, the more frustrated they might get. And so the whole situation escalates really quickly, right? From crying to tears to then screaming, and you've got to try to work out what's wrong. Whenever things like that do happen, I'm a huge believer in making sure that you actually do seek medical attention pretty quickly, especially because it would come down to your intuition as a parent. And look, you've probably heard this many times, and I'm sure a lot of families have heard this many times, because we are often taught to say as health professionals, well, you know your child best. And I remember using that line once because I was taught to back when I was a pretty new graduate, and a parent just sort of snapped back at me and said, well, how would I know them best? Like, you're the health professional. And I was like, oh, that's a really stupid thing to say. Because actually what I've come to realize is we were taught that, but we weren't given the context. And the context is, as a parent, you know your child's cues the best. My role is to use my clinical knowledge and match it up with your cues of what your child is bringing to come to an idea of what might be wrong. And so it actually does rely on a parent's intuition and instinct to kind of go, something is really wrong. I think this is serious. You know, things that you might often say is like, they don't often cry like this. The cry sounds different. Their whole demeanor doesn't seem quite right. And I would make sure that that is always valued, because I think sometimes going into a situation where you've got to seek medical help, so like we're talking about going to ED, for example, you know, it might feel a bit intangible because your child hasn't told you, actually, this place that's wrong, there's nothing visibly that's wrong. But your intuition actually becomes the evidence and the source.
That's really good to hear.
Because it's a hard one, right?
It's such a hard one when you haven't got something tangible to go off, and you have to go and you have to say to someone, my instinct is telling me something's wrong. Can you help me figure it out? So you can definitely arm yourself with some information for that. And I would highly encourage any family to think about that, whether you write a note on your phone, on your notes page, where you can definitely put down some notes where, because in that sort of situation when you're trying to get help, there's so much going on. But so know some information about your child that gives them, whoever you're going to hand over to, some basic objective information about your child. So, you know, things like, know their diagnosis, and if there's any classifications that come with it. And we talked about that a few weeks ago. Like, know their classification in terms of how they usually move, how they usually communicate. That way you can kind of say, this is how they normally function, but at the moment, this is what we're seeing. That's right.
And the other thing that often sets things off is, like, you know, kids might have growth spurts. So know their height, know their weight. And if they've had a sudden growth spurt, then you can add that information in as well. Know what they've eaten. Like, you know, are they off their food lately? Are they well hydrated? What their sleep is like. So you actually have all this information that you would know anyway, but it's actually bringing that information into that context and go, okay, this is not quite right. This is a little bit off. And this seems like this is not quite my child either. That's the evidence that you would bring. And that's why we would take it really seriously.
Okay.
But I think it's a hard one to feel like you can confidently talk about it with a health professional sometimes, because it's the intangibles that make the situation so much more amplified. Because it's unknown.
Absolutely.
So have you experienced that before, where you've had to, like, tell someone something's wrong and you don't really know what's wrong, but you know that your child's crying and you need someone to help you? Like, have you been in that scenario?
Have definitely been in that scenario. And I guess it was tricky to know, is this a ED situation? Is this a situation a therapist can help us with? Is this a situation a GP can help us with? I think that our experience has definitely been from a GP perspective that they are quite quick to refer us to someone more specialised. I think they're happy with, you know, ear infections, throat infections, things like that. But if there's nothing that's really obvious from that perspective, they are quite quick to say, look, I think you need to go to the children's hospital where they have more experience with children like your child. So definitely I think the biggest thing that we've learned is to have videos of good days. Which sounds silly because of course you're going to have videos of good days, but I don't always think about it like that. And so it's
that's
having
your comparison point.
Exactly. Having that comparison to show them. And then also videos of, especially if it's been like a over a few days that you've seen a decline or that you've seen worrying behaviours increasing.
That's right.
Then we've now learned from that experience to take those videos just in case, and then that gives definitely a lot more context to what you're saying as well. And then we learned from doing that with one of our appointments that we did have to take him to ED, they were very clearly able to see a change physically, and they were able to clinically explain that, and that then led them to what they wanted to do in terms of x-rays, ultrasounds, and the area that they wanted to focus on that they thought was causing that pain. So I guess that was a learning curve for us, because at the beginning it was very much we need to scan everything, we need to look at everything, and when you've already got a really distressed child,
you have to prioritise.
Exactly. And so we learned from that as well. We need to implement things that can help reduce that medical trauma, because that having to pin a child down that's distressed and trying to tell you that something's wrong isn't a nice experience.
No, that's right. And I think that's a perfect example of what you as a parent brings to the table in terms of your knowledge of your child, watching as things have changed, and then backing yourself that you've noted that things have changed. And by bringing in evidence like videos or like any change in medication, that you've recorded down, that becomes so valuable to any health professional, whether it is something you go to ED for or you go to your therapist for and go, look, I think there's something wrong. It could be as simple, and it sounds simple, but sometimes often not, but, an AFO not fitting well. Yeah. Is this affecting how they move? Because they're in it every day. Now they don't want to use it, but they're upset. We're trying to work it out. So bringing that evidence in is so useful. And then from there, it really is then the job of the health professional to try to piece it all together to work it out. But you can't do that unless a parent can bring their intuition into the mix. And it's so valuable. Even if this podcast is about giving you permission to make sure you bring that information, know that it's valued, because I think it can feel a bit like, so I've noticed.
Yes, that's exactly what it is. Yeah.
I don't really know. Is that spasticity?
Yeah.
You know what I mean?
Absolutely. Yes. Yeah.
Yeah. So it is valuable. Bring it in. The other thing to think about is really early on, as part of communication strategies, we often like to teach kids who may be nonverbal to use other forms of communication, like low tech, like pet cards, or they might have high tech, eye gaze kind of things. Within that, it's always worthwhile actually just teaching those things like something is wrong, something is sore, and whether it's through pretend play about like a doll that's sore or their leg, and actually going through body parts. Yeah. So helpful, because we would do that for many kids who are neurotypical and teaching them, and you go through that process. So having that sort of ready, at least having that so it's familiar, so you can bring it to them and go, if they're able to, before things have escalated, you might have had an opportunity maybe to try it. I mean, it doesn't always work because sometimes it just escalates too quickly. Or
they aren't able to understand what it is that is the problem.
That's right. So there's lots of factors for it. But again, as a parent, you would probably have more intuition about your child and what they're capable and able to do. And sometimes it's just like, it's so important. Like there'll be a cry and you'll hear it straight away. You're like, oh, that's different.
Yeah.
Or no, I think they're just trying to get out of this. Or, like you would know those things.
Yeah.
And it's just so important for your health professional to follow that. I know for me as a therapist, if a parent were to say that, this is where it's parent jurisdiction, and I go, okay, I get that. Like either push through a little bit because I think they're just a little bit grizzly. They didn't really sleep really well, but I know they really like this toy. Let's try. Then I'll go, okay, let's give it a go.
Yeah.
But if you go, no, this doesn't feel quite right, my job is not to go, no, I don't believe you. I think I can keep going.
Yes.
That would be really a really disruptive thing we could do to a parent-child relationship.
Yes, definitely.
Because you need to read your child and they need to trust that you can read them.
Yeah, and that is good to know, because I think sometimes it is hard to sit back, watch a therapy session and not know when to intervene. And so it is good to know as a parent that you're actually, the therapists are looking for your input on, hey, should I keep going with this? Shouldn't I? What do you want me to do?
That's right.
Yeah.
And look, recently, the more and more I've been talking to families or just reading and understanding motivation and psychology and talking to parents who've been parents for many years of children with neurodisabilities, we've come to this conclusion where, in early intervention, there is actually just no place for crying.
Yeah, good.
Because when that happens, you're not learning anything anyway, but also we need to find ways to value that communication and understand what's wrong, and pushing through doesn't achieve any of that. So, and I think as a parent, your instinct is also to go, what's wrong. Like we need to figure this out.
Yeah.
So yeah.
Definitely. That's good to know.
So I think if we were to summarize it, my thought for this would be parent intuition is so valuable. What you bring to the table helps to set the tone for what's about to happen. And your health professional is constantly looking for you for that sort of, I guess, reassurance about, are we reading the child right? Because yes, unlike what I said in my new grad days, you do know your child best when it comes to their cues and your intuition. And if you can tell me that, I can match it up with my clinical expertise and experience, and hopefully we can come to a good answer.
That's good to know.
Cool.
That's fantastic. Thank you.
You're very welcome. That was a tricky question, but thank you. Well, hopefully that was useful for all of you as well. So stay tuned. There'll be so much more to come, but have a good week and bye.